The following principles are used in the development of all practice standards and guidelines. There are 6 guiding principles that apply to nursing in Ontario. You should consider these guiding principles when you read the college's publications and when you apply the standards and guidelines to your practice. The first guiding principle. In Ontario, nursing is one profession with 2 categories: registered nurse, RN, and registered practical nurse, RPN. When the college uses the word nurse, it is referring to both categories, unless RN or RPN is specifically stated. The second guiding principle. The foundational knowledge base of RNs and RPNs is different. There are areas that overlap between the 2 categories of nurses, such as the performance of client care and academic courses that have similar titles. The differences begin with the foundational nursing education. RNs graduate with a 4-year baccalaureate degree in nursing. RPNs graduate with a 2-year practical nursing diploma. RNs study in greater depth and breadth over a longer period of time. As a result, the clinical performance expectation for each nurse is different. The third guiding principle. This principle builds on the foundational knowledge base. Nurses enhance their knowledge through formal and informal education, experience, and reflective practice. By applying their enhanced knowledge, both RNs and RPNs can become experts within their own category and area of practice. The fourth guiding principle. RNs and RPNs are accountable for their own decisions and actions. They are not accountable for what someone else does or for what they are not informed about. RNs are not accountable for the actions or decisions made by an RPN. However, all nurses are responsible for taking action to ensure client safety. This may include intervening with client care and/or informing the employer of concerns related to the conduct or actions of another healthcare professional. In addition, nurses are accountable for maintaining competence throughout their entire career. The fifth guiding principle. The client is the central focus of the professional service nurses provide and is a full partner in the decision-making process. A client is defined as an individual, family, group, community, or population. The sixth guiding principle. The overall goal is to obtain the best possible outcome for the client with no unnecessary exposure to risk of harm. The college has developed practice standards and guidelines to ensure public protection and to support nursing practice in Ontario. Practice standards and guidelines are broad in nature. They apply to both RNs and RPNs working in different roles and practice settings. How a nurse demonstrates a standard is influenced by the nurse's level of competence, role, practice setting, and the situation. For example, some nurses provide direct client care, while others practice as administrators, educators, or researchers. Nurses also practice in different settings, such as long-term care, the community, and in hospitals. The college develops practice standards, documents with a red title page, and guidelines, documents with a blue title page, to provide a guide to the knowledge, skill, judgment, and attitudes necessary for nurses to practice safely. Practice standards are authoritative statements that describe what each nurse is accountable for and responsible for in practice. Guidelines are documents that assist nurses in understanding their responsibilities and facilitate safe and effective decision-making. To work through a learning module for a specific practice standard, return to the Learning Center